Good morning. It's November 19th, and this is your daily brief in science. Here's everything you need to know. A new study traces the origins of kissing back more than 21 million years, arguing the behavior was likely present in the common ancestor of humans and other great apes. Researchers define kissing as non-aggressive mouth-to-mouth contact without food transfer to enable cross-species comparisons. The exact function of kissing is still debated, with hypotheses ranging from mate assessment to foreplay that could boost fertilization chances and even platonic bonding to navigate social relationships. The study relies on recorded behaviors and simulations rather than direct observation, and data beyond great apes remains sparse, making results sensitive to model assumptions. Lead author Dr. Matilda Brindle frames the work as applying an evolutionary lens to a behavior rarely fossilized, highlighting primate diversity in sexual behaviors. The authors call for more observational data from both wild and captive populations to test competing hypotheses about adaptive benefits across species and contexts. The research appears in Evolution and Human Behavior in 2025, with D01 10.1016/J.EVOLHUMBEHAV.2025.106788. The article also stresses the need for richer documentation of kissing events, whether romantic or platonic, who participates, and how kissing aligns with feeding or mating, to refine evolutionary interpretations. The paper provides a standardized framework for primatologists to record kissing in non-human animals and outlines a path for future cross-species behavioral research. Positioned as the first broad evolutionary analysis of kissing, the work offers a framework for future cross-species inquiry into this behavior. Acknowledging sparse data outside large apes, the study advocates a standardized recording framework to aid future research on kissing in non-human species. Co-author Professor Stuart West notes that integrating evolutionary biology with behavioral data enables inferences about traits that do not fossilize, like kissing. A new 20-year study of more than 320,000 U.S. adults shows that smoking just 2 to 5 cigarettes a day more than doubles the risk of any cardiovascular disease and raises overall death risk by about 60%, compared with never smokers. The research also finds that risk remains elevated for former smokers, potentially for up to 3 decades after quitting, with the strongest risk reductions in the first decade in time since quitting as a key factor. The authors emphasize that no level of smoking is risk-free, and that low-intensity smoking carries substantial cardiovascular and mortality risks, underscoring quitting as the most effective long-term strategy. A disclaimer notes the information is educational and not medical advice, advising consultation with healthcare professionals for medical decisions. Experts stress that quitting entirely is the best course of action. Immediate risk reductions begin after cessation, and ongoing support and cessation therapies help those who struggle to quit. Quitting at younger ages yields greater risk reductions than merely cutting back, reinforcing public health guidance to quit as early as possible. The findings reinforce that quitting entirely is more beneficial than reducing cigarette use, highlighting the importance of smoking prevention, especially among youth. Cutting back without stopping does not meaningfully reduce cardiovascular risk. The timing of cessation is crucial for maximizing benefits. The study, funded by the American Heart Association's Tobacco Center for Regulatory Science and published in PLOS Medicine, notes limitations including not assessing cancer causes of death, not accounting for changes in smoking over time, and lacking data on other tobacco products. Broader context from WHO and CDC shows tobacco kills millions annually, with substantial health benefits from reducing or quitting smoking over time. Public health context. U.S. adult smoking fell from about 42% in 1965 to around 12% in 2022, though there was a rise in people smoking fewer than 15 cigarettes per day. The study, led by Michael Blaha of Johns Hopkins, analyzes long-term data to clarify the dose-response relationship between smoking intensity and cardiovascular outcomes. A new human cell-based bone marrow model has been engineered at macro scale, 8 mm in diameter and 4 mm thick, to sustain human blood formation in culture for weeks. Developed by researchers from the University of Basel and University Hospital Basel, the model recreates multiple bone marrow niches, including the endosteal niche near the bone surface, using hydroxyapatite as a scaffold and high-PSC-derived cells. This is the first realistic bone marrow model engineered entirely from human cells, published in Cell Stem Cell, with the aim of improving cancer therapies and reducing animal testing. While promising, the current size may limit parallel testing of many compounds and doses, highlighting the need to miniaturize for high-throughput screening. Researchers note that miniaturization and further development are needed to enable personalized medicine workflows within this platform. Nevertheless, the team envisions optimization to test multiple compounds and doses and to study blood diseases and blood cancer mechanisms despite the present scale. Led by Professor Ivan Martin and Dr. Andres Garcia, the work marks a step toward replacing some animal experiments with human cell-based systems and is reported in Cell Stem Cell. The Basel team, from the Department of Biomedicine, published the study under Martin and Garcia's leadership. In Cell Stem Cell, the researchers describe a macro-scale scaffold-assisted model of the human bone marrow endosteal niche using high-PSC vascularized osteoblastic organoids. The study, titled Macro-Scale Scaffold-Assisted Model of the Human Bone Marrow Endosteal Niche Using High-PSC Vascularized Osteoblastic Organoids, was published on November 18, 2025. The model aims to reduce reliance on animal experiments and could complement animal studies by improving understanding of healthy and diseased blood formation, as well as informing drug testing and personalized therapies. Potential applications include drug testing and, in the long term, patient-specific personalized therapies by testing treatments on bone marrow models to identify the most effective option. This work addresses a major gap in bone marrow research, moving beyond animal models and traditional cell cultures toward more human-relevant in vitro models. The model integrates multiple niche components: blood vessels, bone cells, nerves, and immune cells, providing a more complete human cellular ecosystem than prior models. A new Phase 3 result from Roche Genentech shows giredestrant, a selective estrogen receptor degrader and complete estrogen receptor antagonist, improving invasive disease-free survival as an adjuvant therapy in ER-positive, HER2-negative early breast cancer. The interim analysis indicates a statistically significant and clinically meaningful benefit versus standard endocrine therapy in the adjuvant setting. Roche notes, lidERA is the first Phase 3 SERD trial to demonstrate a significant adjuvant benefit, with early signals suggesting a positive trend in overall survival, though maturity was limited at the time of the readout. The news was picked up alongside broader market implications, with Olema Pharmaceuticals seeing its stock jump about 167% to roughly $22.71, and Roche shares rising about 8% to around $48.29. Full trial details were not publicly released at that time, with access restricted to subscribers or sign-ins on BioWorld. BioWorld's coverage places lidERA within Saran wrap framing and connects it to ongoing discussions in the breast cancer treatment landscape. Olema's palazestrant, another complete ER antagonist and SERD, is in two Phase 3 trials, OPERA-01 and OPERA-02, with enrollment ongoing, contributing to stock momentum in Olema. While full results hadn't been published publicly yet, the data were expected to be presented at an upcoming meeting. Roche's broader breast cancer portfolio, including Herceptin, Perjeta, Kadcyla, and Phesgo, along with activity around inavolisib and related FDA-approved combinations, underscores the company's continuing oncology strategy. Context notes also highlight rising metastatic breast cancer diagnoses among younger women and point to screening gaps, lifestyle factors, and COVID-19's impact on diagnosis timing. A coordinated approach to ADHD and substance use disorders is proving more effective than treating them one after the other. Integrated care combines pharmacotherapy, cognitive behavioral therapy, motivational interviewing, psychoeducation, and multidisciplinary coordination to address both conditions at once. Pharmacotherapy for ADHD, especially stimulants, can improve retention in SUD programs when carefully supervised, balancing efficacy with abuse risk. Clinically, reducing ADHD symptoms acts as a protective factor for recovery, making integrated care models that center ADHD essential in addiction treatment. The INCAS studies and related research show that when ADHD and SUD co-occur, there is more intense addictive behavior, higher psychiatric comorbidity, and a poorer prognosis than when these conditions are treated separately. People with both conditions often begin substance use earlier and experience a synergistic rise in severity, complicating recovery. Untreated ADHD in adults with SUD raises the risk of developing SUD itself and is linked to earlier use, greater addiction severity, and more psychiatric issues, partly due to shared dopamine-related dysfunction in reward circuits. Overlapping neurobiological mechanisms help explain the higher SUD risk when ADHD and SUD co-occur, with dopaminergic dysfunction in reward pathways playing a key role. Estimates suggest untreated adult ADHD increases SUD risk by about 15 to 25%, with self-medication via stimulants, cannabis, or alcohol contributing. Multidisciplinary collaboration among psychiatrists, addiction specialists, psychologists, and social workers improves patient satisfaction, symptom awareness, and stable recovery. While accurate ADHD diagnosis in the context of SUD remains challenging due to symptom overlap and masking from active use or withdrawal. Longitudinal follow-up with individualized care, pharmacogenetic research to tailor ADHD medications in SUD populations, and digital tools to support adherence and self-monitoring are listed as future directions. Psychoeducation, tailored CBT, organizational skills training, emotional regulation, and motivational enhancement together support adherence and relapse prevention when paired with ongoing substance monitoring, with multidisciplinary collaboration improving outcomes. Neurocognitive and behavioral approaches, customized CBT, organizational skills, emotional regulation, and motivation enhancement help sustain engagement and reduce relapse risk when combined with substance use monitoring. This has been your daily brief in science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.